Jean Mixer has been guiding Boston Children's Hospital into the digital future for the past 7 years, so she was more than prepared when the COVID-19 pandemic arrived and suddenly everyone was forced to go remote. I first met Jean at Boston Consulting Group in the 1990s when she led growth strategy projects in healthcare, financial services, and consumer goods. We stayed in touch and reunited about 5 years ago when Health Business Group helped Jean put the children's digital strategy in place. In this episode of the Health Biz podcast, Jean traces her journey from JP Morgan to BCG to her own consulting practice and then to Boston Children's. She shares her experience as a director of public companies in biotech, medical devices, and banking. And she explains what she'd do if she had a time machine. I'm your host, David Williams. Thanks for tuning in, and remember to subscribe to Health Biz. Jean, it is terrific to see you today. How's it going?
David, it's great to see you as well. It's going very well.
Excellent. So let's back up and talk about your background, early life, career, and all that. What's your story?
What's my story? Well, my first job was on Wall Street at JP Morgan, and that gave me a really good breadth of how the world works and sort of a broad lens view. And then I went off to business school, and then out of business school, I joined BCG. And that was a great decision, and it sort of launched from there.
So when JP Morgan, a lot of people think about it as a big investment bank, but in healthcare, it's like there's the JP Morgan Healthcare Conference. I don't know if we'll be having it this coming year, but maybe like working at JP Morgan sort of foreshadowed your arrival at healthcare. What do you think?
Well, actually, some of the early work I did in healthcare was actually at JP Morgan. We, at the time, believe it or not, Clinton was in the White House, and they were trying to push through national healthcare reform. And I wound up representing JP Morgan on the Business Roundtable on healthcare reform. So that actually, oddly enough, was my first introduction to healthcare.
Very good. Well, that's before we met, which was, of course, we did meet back at Boston Consulting Group in the mid-90s when you were always a step ahead of me, and we were more generalists at that time. So I know you were doing some healthcare work, but you were doing financial services, consumer goods. How did that all come together to you focusing more on healthcare?
Well, one of the things that BCG really believed was the broader you went, the more rapidly you would develop. And so one of the great things I loved about BCG is it really got me all the way across the healthcare value chain. So I worked, yes, in a few providers, but also in pharma, retail pharmacy, PBMs, med device, insurance. And so you really could sort of see healthcare restructure across the value chain. But we also did a lot of great work in the 90s in the dot-com era. And so as that came along, there wasn't a ton of going on in the dot-com space in healthcare. And so I honed back into financial services where I had come from, where a lot of things were going on in terms of disintermediating the way the $90 broker used to work for a trade and was now becoming $9 and is now practically zero. And in consumer goods and services, both of which those themes are now very relevant in healthcare today as doctors are thinking about how to rethink their model. And as frankly, we need to become much more consumer oriented. But one of the things I really loved about my time at BCG is it did give you that breadth.
No, it was fun back there. And of course, you were a partner at BCG, and then you decided to take off for some reason. And what was the time in between you did that and arriving at Boston Children's?
So I left BCG and went out on my own and launched my own firm. And part of that actually was to get off the road. I had small children at the time, and the youngest had some substantial health issues, and it was pretty hard to solve remotely. Telehealth didn't exist, and you're standing in an airport in another city trying to navigate through things. After a couple of years of that, it just wasn't working. And so
it's too bad we didn't have it's too bad we didn't have the pandemic then, because you could have had a good excuse to stay home, right?
Exactly. So I launched my own firm, and then by the time I was joining Children's, I had traveled the world, been a BCG partner, worked on Wall Street, launched my own firm, and I thought, well, maybe I should do something a little bit more mission based. So I emailed my clients and told them I was going to go help Children's for 2 years, and that was 7 years ago.
Yeah. So, There we are. So you didn't have the 2-year itch, but before we get to the 7 years, so why Boston Children's? I mean, it's not, you had children, you're in Boston, and was it as simple as that? You're in healthcare. I mean, why? It's not an obvious place for a banker or a consultant to go.
No, it's definitely not an obvious place. As I was looking sort of across about value chain in healthcare. And at that point, I was sitting on, I was sitting on two public company boards, one of which was in the med device space. And I was sort of serving clients broadly. And, one of the things I was looking for is where did I actually think innovation was going to be occurring? And there's a lot of stuff going on in healthcare, whether it's genomics or immunology or microbiome, really on the medical front of really discovering that what we used to think was one disease is actually many diseases. But I also thought there was a lot of opportunity in terms of just the healthcare structure itself to really do redesign, to fundamentally come up with, more efficient models that had greater access and, greater convenience and lower cost.
So we say sometimes things seem to change slowly in healthcare. But having said that, I think some of the things that you've been working on and some of the things that Children's have actually undergone quite a lot of change in 7 years. What have you seen, since your arrival at Children's in terms of how things have changed, at least in the areas you're working on?
Well, there's been a lot of change, and there's a lot that's changed in the market, and there are some, there's some scientific things that will take years to play out. We're doing some really exciting things in genomics, but it will be years, not weeks or months, before that all comes to fruition. In the digital space where you and I have worked together, that's a place where, frankly, product development cycles are much shorter. And so, if you look at what just we've been able to accomplish this year in the wake of COVID. We launched off a global disease tracker that allowed us to predict the migration of the infectious disease back in December. And so we were working with the WHO and the CDC.
You're working with the WHO on the what?
Yeah, exactly. The WHO on the what. I have a brilliant colleague, John Brownstein, who leads a lot of that work. He's a PhD epidemiologist, and it's been really instrumental in helping us track globally the pandemic. And then as it was reaching the U.S. shores, we launched off a number of apps to help us track better what were the symptoms people were having here in the country. And then we've launched off more specifically, symptom checkers, working with outside partners so that we can actually figure out, what kind of care people need. And then, we're currently working on a contact tracing within our hospital so that we can actually be alerted when we are, close to exposures. And so it's been a significant opportunity to use sort of online and social listening and partner with tech partners to sort of tackle the disease. So that's been terrific.
I mean, one of the amazing things about Children's, and there's a lot of amazing things, is there are a ton of different initiatives going on in digital health, e-health, m-health, whatever you want to call it, over time. And I know you've been focusing in that area, and you just mentioned some initiatives with COVID. Did COVID help to crystallize things, or were things already moving along? I mean, obviously people hear about, telehealth suddenly became popular, but were there other things that are sort of on the cusp of adoption where COVID either helped to push it ahead or has held it back? What has happened?
Absolutely. And so, David, you've been instrumental in helping us, 5 years ago, build out our digital health strategy. And so much of what you and I worked on 5 years ago is now coming to fruition now. And I'm no longer the person entering rooms sort of saying, hey, the future is coming, we need to change. Everyone kind of gets it. And so you mentioned telehealth. In the month of March, we went from 1% of our outpatient visits being virtual to 85%.
Yeah.
And so in 4 weeks, anyone who was a skeptic became a user.
Now, most people I've heard have gone kind of back down, to the baseline. I've been surprised. What are you seeing there?
Well, honestly, we hit that 85% level, and we have maintained. While our in-person visits have come back up, the total volume of the virtual visits has maintained. So we're still about 50% of last year's volume we're doing virtually, and about 50% of current volume we're doing virtually. And so the numbers have remained high, and I think that's partly because people are very committed to providing care, and they're also very committed to doing it safely. And it's something that the consumers have rapidly adopted.
So 7 years, you say you've been there just about, and but who's counting, right? What would you say are some of the the key initiatives and accomplishments that you've had there? It's probably worth just kind of, I don't know if anybody ever asked you to kind of catalog those, but I know you've been working on a whole bunch of things. Are there some that you would consider kind of the key ones?
Well, from a strategy, I wear a couple hats at Children's. One, is the digital hat, and which really came out of coming in a strategy role, and they asked me to build a digital health strategy, and we did. But on the strategy side, some of the work we're doing in genomics, I think fundamentally will be game changing in the future. Our ability to actually, sequence a patient, identify the genetic mutations, match those to a disease, and then match those to a treatment. We are just at the very early stages of. There are over 7,000 rare diseases, half of them are present in children. Typically, it takes 5 to 7 years of a diagnostic odyssey to actually get an accurate diagnosis. So we're still at the very early stages of that. And I think that that has the potential to be transformative in the future. So that's one I'd pick out. And then I think what we've seen in virtual visits, again, there was a lot of skeptics, but I think, the moment we basically got that up and running, it quickly came back that, hey, we need to digitize across the whole patient journey, which again was very consistent with the strategy that we had outlined. But there's no reason why all of the paperwork you have in healthcare, shouldn't really be running mobile in the same way that it works in airlines or travel or other industries. And people always sort of say, hey, healthcare is much more complicated and much more regulated. It really cannot be compared to, Amazon. But, financial services is actually very complicated and heavily regulated and has a lot of data that requires confidentiality and security. And they have largely made huge strides in, making data ubiquitously available across the financial services network globally in a confidential manner. And so it is possible.
So it's great to hear being able to do things, because I think you do need that timeline to really make things happen. It's if you sort of do it 2 or 3 years, it's not enough. So I think you're getting to the point actually where there's some things you can really look back on. Children's is a terrific place, as I know from having been there, taking my kids there. It's also a big, bureaucratic place. It's part of the Harvard system. It's run by physicians, and for us business people, that doesn't always make it the easiest place to work in. It's worth it, and yet on the other hand, there's some challenges as well. Any frustrations or regrets that you've had up to this point that you can share?
Well, I remember working at BCG, and, there was kind of two aspects of our job. One was, could you find the right answer, right? And then the other was, it doesn't really matter if you find the right answer if you can't actually get people to embrace it and make the change happen. And so you really need to have both the strategy as well as the change management. And there's no such thing as having, too much change management skills, right?
Right.
Any large transformation you want to make, whether you're starting from being a startup and you're trying to transform the world by coming up with something that's a really disruptive and innovative product or service, or whether you're sitting in a large organization and you're trying to drive transformational change for the next leadership, either way, you've got to figure out how do you get disparate parties, many of which you do not have control of, do not report to you, and to actually align so that you can allow things to get to market. So early on in my BCG career, I got to work on the drug and HIV that stopped people from dying in the streets. And that was an incredibly difficult product to get to market. And that's true of a lot of innovations. They are difficult to get to market. And so whether you are the disruptor or you're the one being disrupted who needs to change, the skills you need in order to figure out how do I align across the system to get these changes to happen are a great set of skills to have.
Well said. No, I would agree. I've never seen. Let me know if you see somebody with too much change management capability.
Yeah, exactly.
I haven't seen them yet, but that is a good one, and something that you don't necessarily realize early on at BCG, but we learn it over time. Gina, I was looking at some of the things you've done recently and some of the web pages, and there's this innovation and digital health accelerator page, and they ask everybody, I guess, what their favorite innovation is, and you said time machine. And so if that's your favorite one, I was wondering if I could borrow it when you're done with it.
You absolutely can. And this actually comes from when you and I, David, used to work together, which is we had to be with clients all over the world. And I just wanted something that could zap me very quickly in between clients without having to get on, these long flights. I got to fly on the Concorde, but frankly, that only goes between a couple locations at the time. That did not get us out around the globe. And then I wanted to be home in time, for bedtime. And so I wanted this, teletransporter. I also wanted badly the ability to go back and forth in time. And so we don't have either of those yet. But what I will say about digital is it allows you to begin to get some of the benefits. And so one of the things I love about digital is it can make you available in multiple places around the world instantaneously via video. And it can actually help you transport across time. And so if you look at some of the things like what we know about DNA right now allows us to go back and solve crimes that were previously committed that we couldn't solve at the time. And in healthcare, we've discovered the same thing in things like genomics. We are sequencing children today and storing that information so that in the future, when we figure out And when drugs become available, we'll actually be able to go back and sort of say, hey, we identified people before who had this. Now let's go back in time, find them, and get them the therapies that they need. And so there is opportunities to sort of travel back in time. And there's opportunities to travel forward in time. And so some of the work you and I did together around the concept of clinical decision support tools, which are kids, and for that matter, patients, are cared for all over the world, and yet we don't have very even distribution of our expertise. But to the extent you can take that expertise and download it into software, you can make it ubiquitously available. And that allows people, the clinicians I work with today, to leave a legacy behind them. And so they may not be here in the future, but they can leave the legacy of their knowledge embedded in software, for future generations.
I remember back at BCG, actually, one of our colleagues, Eric Brandt, I think it was Eric, so if I'm misquoting, then he'll forgive me, I hope. But when you do these case studies, where you're doing an interview and you ask someone to solve a case, and he had one where he said, okay, there's a time machine that's been invented.
Yeah.
Price it. Like, what should the price be for it? I think it was one that he wanted to use, but I think they didn't let him use it because it was a little too outrageous to have it. But it sounds like the price might be higher now, given all the uses for the time machine than they were in the past.
I think it would be hugely valuable, right? If we had a time machine and could go back to the beginning of COVID, would we have managed it differently?
Yeah, we'll leave that one for the historians. So you mentioned already that you had played some roles on public company boards, and there have been multiple boards that you've been on. Then what have you done in terms of boards, and what's the common thread there?
So when I left BCG, and as you know, at BCG we were precluded from serving on company boards, I joined the board of a bank, and then following that, I joined the board of a med tech company, and then I now sit on the board of a biotech company. And I think the common thread is, when people, and it's the same thing in consulting, frankly, no one knows a company better than the management team of that company. They deeply understand their business. And where you really add value as an outsider, whether it's a consultant or a board member, is by having perspectives that are coming from the outside, tangential to it, because you're never going to deeply understand their business as much as they are. And so in each of these cases, there were ones where I had enough context to understand their business, but also enough context to bring things from the outside. And each of them faced sort of, in some ways, what we're all facing right now is we're facing a market that's a whole lot of lemons, and we got to figure out how to make lemonade out of it. And, there are ones for whom that's a defensive move, and there's ones for whom that's a tremendous opportunity. But at the bank, we lived, I was on the board during the 2008 financial crisis, and that was a huge crisis in banking. And it was also a huge opportunity for them. And so, for them, that was their moment of opportunity. At Next Stage, they were really positioned as an innovator in what was a highly consolidated sector. And so for them, working their way to how do you actually get an innovation to market in a really consolidated sector, ultimately by actually partnering with some of the bigger players. And then now in the biotech, they also have, I am a little bit of a maven for transformational things.
Yeah, I say maven is a better word than glutton for punishment.
Yeah. They also have an opportunity to be really transformational. They're working in the microbiome space, which is a space, that clinically really has a lot of promise. But, this year has been a challenging year for them too, which is it provides both opportunities in the wake of COVID as well as significant challenges. So I think that is the thread. The boards that I have said no to are ones that are really viable businesses, but you look at it and you sort of say, it looks to me like you got a straight shot,
Yeah.
And it also maybe looks like when you're done with that roll up, it's not necessarily going to be transformational either. So
got it. So you like the tough ones where you can actually add some value, and there's something actually satisfying and useful once they've made their goals.
Exactly.
Yeah. No, I mean, I think on the microbiome one reminds me a little bit what you were saying on the genomics side. You come in, there was something you thought was one disease and it means all these other ones. And then the microbiome is something probably we were barely talking about, 7 years ago when you came in, and now it's really kind of the next frontier, which is pretty cool. Yeah. I found on the boards I've been on, which are private company boards, that it also kind of, on the one hand, you're bringing this outside perspective that's pretty valuable. And then on the other hand, you're also seeing things and learning, from what they're doing that you can actually bring back to your day job as well. And I found that to be useful. Sometimes actually more breadth, like looking at In my case, looking at like multiple customers in the pharmaceutical industry. And then when I go and work with one on the development side, you'll have just a general sense of what's going on. So I found it useful in ways that I didn't expect.
Yeah, and I find that there's always analogies that aren't necessarily, some of the things that I learned in pharmaceuticals was really helpful on the med device board, and it wasn't necessarily obvious up front. And there were some things that we learned in retail as we launched clinics that were actually really helpful on that front as well. So sometimes things come from different courts than you might expect.
Yeah, good. So, Gene, I know you're super busy with, every stage of life, and you're not flying around too much anymore, so not that much downtime for reading. But have you managed to read any books through the pandemic? Anything that you're reading that you either recommend or recommend people stay away from?
Well, I have to admit, we have been pretty flat out with COVID response, certainly, and with getting everything scaled digitally. But I have been reading Kendi's book on how to be an anti-racist, and this is a time where if we don't like the current scenario of what we're in right now, then we're sort of obligated to think about a future being different, and that means if we're going to make the future different, really understanding how to do that. And so I think we have tremendous opportunities, and anyone, frankly, who's launching new business models or new products or new services, it's an opportunity to do things differently than we have in the past.
No, that sounds good. I've been trying to do some reading. When the pandemic first started, I was thinking, I'm going to have all this time. I bought a book on how to play bridge and stuff like that, which I don't know where the book is, but I could return it because it was new in the sense of not having cracked the binding on it. But I was reading a couple books lately. They're both actually translations, one from Japanese and one from Spanish. And one is called, I think, Miracles of the Namiya General Store, which is like a very fantasy kind of a book. And it's you have to suspend disbelief, but it's kind of very uplifting and very positive. And then this other one is called The House Guest, which is like it's just like one depressing story after the other. Some terrible creature that emerges like in the story, and it's like, I'm reading this, and it's the first one is like it's kind of spellbinding and it's very tense. And by the latest story, I'm like, all right, this woman seems happy. Now, where's the monster? And sure enough, it's there on the next page. So I don't recommend that one. Maybe that one's good for after the pandemic, but the Miracles of the Namiya General Store I'll recommend for anybody right now.
Well, that sounds like a great recommendation. And for the most part on House Guests, we all wish we could actually have them at this point.
Yeah. So speaking of which, how are you looking forward to the holidays?
I am looking forward to the holidays. They won't be the same holidays that they've been other years, but it is always an opportunity to make lemonade out of lemons.
Excellent. Well, Gene, I don't know if lemons are in season, but I guess they will be this year, one way or the other. I want to thank you very much for spending time with me on the Health Biz podcast today. It's been great to catch up with you and to hear both what you've been doing at Children's on the boards and then the earlier sweep of your career that I wasn't aware of. Well, great. David, is a pleasure to connect with you. You've been listening to the Health Biz podcast with me, David Williams, president of Health Business Group. I conduct in-depth interviews with leaders in healthcare business and policy. If you like what you hear, go ahead and subscribe on your favorite service. While you're at it, go ahead and subscribe on your second and third favorite services as well. There's more good stuff to come, and you won't want to miss an episode. If your organization is seeking strategy consulting services in healthcare, check out our website, healthbusinessgroup.com.